Greetings, nurses and midwives in Ireland on this special occasion as you celebrate the International Day of the Midwife and the International Nurses Day. It is special because it is happening in this year, the International Year of the Nurse and the Midwife, and during the worst global pandemic we have ever experienced. I want to start with a heartfelt thank you for each and every one of you for all that you do to save lives, for the care you provide, the sacrifices that you make, and the extraordinary impact that you have on the lives of women, newborns, patients you care for, their families and friends. I want to pay tribute to the nurses and midwives who have been infected and those who have died in the line of duty during this COVID-19 pandemic, and extend my condolences to their families and friends. Nurses and midwives responding to the COVID-19 outbreak place themselves at personal risk of contracting the disease, work longer hours, suffer psychological distress, fatigue, burnout, stigma, and physical and psychological violence. Yet nurses and midwives return day after day to ensure those affected in hospitals, nursing homes, communities, and those in home isolation receive the necessary care and advice. Your actions are courageous and selfless. I thank you. Inadequate supply of personal protective equipment has been raised as a main concern by nurses and midwives in many countries. Governments and employers must ensure nurses and midwives have the necessary training, the equipment and support they need to prevent infection. As at the 21st of April, countries reported to the World Health Organization that over 35,000 health workers were infected with COVID-19. We think there is underreporting, and these numbers are significantly higher. Nurses and midwives infected with COVID-19 following exposure in the workplace should have the right to employment injury benefits for occupational disease, including compensation, rehabilitation, and curative services. The 2020 International Year of the Nurse and the Midwife saw many aim to further elevate and raise the awareness of these two professions for its contributions to universal health coverage and the Sustainable Development Goals. The global nursing and midwifery communities saw this as opportunity to leverage for investment in the health workforce, and especially for nurses and midwives beyond 2020. The response to the COVID-19 crisis is highlighting some of the shortcomings within healthcare systems in many countries, and the existing healthcare challenges are made worse as countries work to contain and mitigate the virus. I encourage you to use the data and evidence in the first stage of the World's Nursing Report and the midwifery impact and return on investment papers to continue to influence governments to make policy changes in addressing the shortcomings experienced by nurses and midwives in the midst of COVID-19 crisis, and call for investment in nursing and midwifery leadership, education, and more jobs. The World Health Organization remains ready to support countries now and beyond 2020 to use the nursing and midwifery data and the evidence in policy dialogue to strengthen nursing and midwifery through policy shifts based on your country priority needs. There are nearly 28 million nurses and midwives globally, and making up nearly 60% of the healthcare professionals. They are the backbone of the healthcare system. I call on governments, policymakers, employers and regulators to coordinate actions in support of decent work. Adequate staffing levels and workplace and occupational health and safety must be prioritized and enforced. In addition, policies to safeguard nurses and midwives from sexual harassment, violence and discrimination within the workplace must be developed and enforced. This is a call to action for governments and employers to make more investments in the nursing and midwifery professions. Midwives and nurses, celebrate your days, take care and stay safe. Thank you.